Jen, your tests all came back looking wonderful. You're watching your diet and exercising, which is great. You're doing a great job with your medications and controlling symptoms. So be well, and now it's showtime.
Well, one of the many things the coronavirus pandemic has done is change the way we communicate, albeit temporarily. That includes communication between you and your doctor. Telemedicine is in the spotlight, and it is exactly what the doctor ordered. Doctors like our next guest, Dr. James Trumbull. He is the Vice President of Clinical Integration at Peninsula Regional Medical Center. Doctor, thank you so much. How are you doing with at the hospital?
So far, so good. Certainly, it is a very stressful time, I think, for all of us, and that it doesn't exclude hospital staff either. We're working through a lot of processes to be ready for what we are predicting would be a surge of these the COVID virus cases, but certainly we're hoping for a better outcome, especially considering all the efforts that we are as a community putting into keeping ourselves relatively isolated and sheltering in place and minimizing exposure to each other.
And one of those ways is with telemedicine. Give us a broad definition of telemedicine. What is it?
So telemedicine literally is medicine from a distance. So that can take a couple different forms. We've done telephone calls to patients in the past to check up on people, but typically what we're really talking about here in kind of more of the modern age is exactly what we're doing right now is a video conferencing or a video telemedicine visit where you have at least some semblance of an interaction. I think there's a lot of people that really very much enjoy that personal connection. And you on telephone, you kind of miss the mannerisms and the facial expressions that really go into how we communicate. Sure. And so that offers kind of an in-between for a lot of people, but yet still trying to keep all of us safe and relatively away from each other to prevent those exposures that we're trying to avoid.
Are we prepared? Are practices prepared to use telemedicine?
They are, both here in our own medical group and in our sister hospital at Nanticoke. We've set up various platforms to work out of those practices. And many of the practices in the Salisbury area as well, as we've kind of integrated together as a semblance of a community here for medical practices, many of them are already doing telemedicine.
So for the patients who have not used it and want to use telemedicine, what do they need to know? How do they approach their doctor about it?
When you call to make an appointment, just like you would any other time, it's certainly a question that you can ask. Is this right for me? Can I do a telemedicine visit? It really very much depends on the problem. For some people, it's just a matter of, this is an appointment to talk about your medications or side effects. Some of it is updates on long-term problems such as diabetes. But we're getting more and more adept at this and able to take on other problems such as sick visits and more complex visits. And, and I've said this a few times here recently, kind of paraphrasing Voltaire, that we can't let perfect be the enemy of good. We need to be able to use these modalities in new ways and in ways that we hadn't really considered even in the past in order to try to protect ourselves and our community.
So with that said, do you think that telemedicine could become the norm after this is all over?
I would say we're probably going to leap years ahead of what we would have been had it not for these circumstances. So will it become normal? It's certainly, to some degree, yes. It's certainly going to be much more common. I think that, once this crisis is over, months, year and a half from now, as at the very latest, I hope, that we'll be using telemedicine much more actively and to a greater engagement for patients in the area. And we'll see what the benefit is, because we're already seeing how this really truly benefits those with chronic diseases, those who have a hard time getting out or have transportation issues. And in this circumstance, in this situation, it's really almost like simulating that, in that we don't want those patients to necessarily expose themselves. So therefore, it serves that purpose.
Sure. So what happens if you're doing a session with a patient and you do see something unusual or something that concerns you? What's the next step?
It depends on the problem. So if I had an interaction with a patient and I was expecting it to just be some follow-up from a previous visit or from a hospital visit, or I was just going to go over their medications and make sure they were doing okay and not having any problems, and they started telling me about some other symptoms that they were having increasing difficulty breathing or were having some chest discomfort. Really, that's not something that you're going to be able to assess very well over a phone or even over a video teleconferencing, because there's a certain amount of I would say touching, but it's going to be hands-on medical care.
Sure.
That you're going to have to do in those cases that really are going to require an in-person visit. And depending on the severity of those complaints, it may be something in the office, an urgent care, or even the ER if it's really severe.
All right. I think it's the wave of the future, certainly the sign of the times. Dr. James Trumbull is the Vice President of Clinical Integration at Peninsula Regional Medical Center. Thank you so much for taking time out, and stay safe.
Thank you for having me. You stay safe too.
Thank you.